The World Health Organization was established on the 7th of April in 1948, which every year is celebrated as World Health Day. It is a United Nations specialized agency which is responsible for public health. Cholera epidemics in 1830 and 1847 caused for the first International Sanitary Conference, which was held in Paris in 1851. Even though, due to political differences and the unknown cause of the disease, little was accomplished, this marked the first international cooperation for disease prevention and control. In 1892, the International Convention for the Control of Cholera was held. In 1902, the International Sanitary Bureau was established, which was the forerunner of the Pan American Health Organization. In 1907, the OIHP was established, followed by the Health Organization League of Nations in 1919. After the Second World War, the establishment of a new international health organization was voted in by the UN Conference on International Organizations, which was later approved by the International Health Conference in New York. In 1948, its constitution had obtained enough signatures and was thus brought into force. The first assembly met in Geneva in the summer of that year, where it established its priorities. In 1969, the assembly established the first international health regulations, which is an agreement between the member states of the WHO to monitor and control 6 infectious diseases. The Constitution of the World Health Organization states that health is a human right and all people should enjoy the highest standard of health. The WHO has played a leading role in public health achievements such as smallpox eradiction, near eradication of polio, development of a vaccine against measles and Ebola, and many special programs have been found. Since the COVID-19 pandemic, the WHO has been on the forefront where they coordinate advice to states and offer ongoing management of the outbreak. Apart from that, the WHO needs to engage in foreign policy and offer diplomatic expertise. And from the start of the pandemic, the cooperating states and the WHO dominated the narrative. However, the organization has been battered with criticism during this period as well. One of the biggest areas in which they received criticism was how they dealt with China during the pandemic. Some argue that crucial time at the beginning of the pandemic was lost due to a lack of information being reported by China, and that the WHO applauded the government for their response, even if the response was flawed. The Trump administration has accused the WHO of failing to provide timely and accurate information on the virus. Some argue that the WHO has not been political enough, argumented by the fact that they are avoiding politics and international relations, even though the organization itself remains to be of a political structure, but having their main focus on science rather than politics. As many leaders across the globe started to question as to how the pandemic got started, the need for an independent review increased of the lessons learned of the COVID international health response. On the 73rd World Health Assembly last May, member states adopted a landmark resolution that called on the WHO to initiate an independent and comprehensive evaluation of the lessons learned from the international health response. At the World Health Assembly of 2021, the panel will present its substantive report.